Here's how an ER works. We identify the problems coming through the door, assess which ones are most urgent, and work down the list. It's an effective system, but...
I went to the ER because I had nowhere else to go. But in the end, they couldn't do anything for me. Weeks later, I was right back there again. And this went on for years.
These young adults, unfortunately, they're not finding the help that they need.
Most of the time, they don't actually need a doctor or a prescription.
What they need is someone who has the time to listen, to empathize, provide a sense of hope. These are things the emergency department just isn't set up to do, no matter how much our staff want to help.
When you finally find the strength to reach out for help, that's your window for recovery. And if we miss it, we just can't let these young people keep slipping through the cracks.
With the right peer support, my daughter was able to work herself out of her own personal hell. And now she has a treatment center named after her.
When you walk through the doors at Stella's place, you're greeted by a peer like me. Someone who's been through what you're going through, who listens and gets it.
Peer support's been a crucial element of all successful mental health and substance use programming to date. And Mount Sinai Hospital is now partnering with Stella's Place to launch Pathway to Peers.
The program will place full-time peer support workers in Mount Sinai's ER to provide the most effective treatment at the time it's needed most.
Imagine being greeted at the ER doors, not by a long waiting list, but by an ally.
You can develop the coping skills, and you can get better. Now, I've been traveling the world. I've been speaking to thousands of people in Colombia, Ireland, the US. And here I am now doing a TED Talk like, whoa. But most young people who have stories similar to mine don't have a happy ending. So what can we do to do better for these young people?
By evaluating Pathway to Peers over time, we aim to prove that this model works.
We're going to prove to young people with mental health and substance use issues that they are not alone.
And then we're going to scale it to other hospitals.